tibialis anterior is going to originate on the lateral condyle of the tibia, the proximal lateral surface of the tibia and interosseous membrane, and will insert in the medial cuneiform and base of the first metatarsal. Extensor digitorum longus is going to originate at the lateral condyle of the tibia, the proximal anterior shaft of the fibula, and the interosseous membrane. It will insert in the medial and distal phalanx of the second through fifth toe, so everything except the big toe. Fibularis brevis, or peroneus brevis, will originate at the distal 2/3 of the lateral fibula and will insert at the tuberosity of the fifth metatarsal. Fibularis longus, or peroneus longus, will originate at the head of the fibula and proximal lateral 2/3 of the fibula, and will insert at the base of the first metatarsal and medial cuneiform. Tibialis posterior will originate at the proximal posterior shaft of the tibia and fibula and interosseous membrane, and will insert on all tarsal bones and the bases of the second through fourth metatarsal, excluding the big toe and the pinky toe. Flexor hallucis longus will originate the middle half of the posterior surface of the fibula and will insert at the distal phalanx of the first toe, or the big toe. Plantaris originates the lateral supracondylar line of the femur and will insert at the calcaneus via the calcaneal tendon. The popliteus originates at the lateral condyle of the femur and inserts at the proximal posterior tibia. Gastrocnemius or gastrocnemius, whichever pronunciation you prefer, will originate on the condyles of the femur, the posterior surfaces, and will insert to the calcaneus via the calcaneal tendon. soleus is a little more tendinous than this picture shows, but it originates at the soleal line, the proximal posterior tibia and posterior head of the fibula. It will insert at the calcaneus via the calcanea tendon. This is just deep to the gastrocnemius and just kind of pokes out the sides there. Adductor brevis originates at the inferior ramus of the pubis and inserts at the pectineal line and medial lip of the linea aspera. It is the second highest of the thigh adductor. Adductor longus is next. It will originate from the pubic tubercle and insert at the medial lip of the linea aspera. Adductor magnus, the biggest of the adductors, will originate at the inferior ramus of the pubis, the ramus of the ischium, and the ischial tuberosity. It inserts at the medial lip of the linea aspera and the adductor tubercle. Gracilis originates from the inferior ramus of the pubis and will insert at the pezantherinus insertion point at the proximal medial shaft of the tibia. Pectineus is just superior to adductor brevis. Its origin is the superior ramus of the pubis, and the insertion will be the pectineal line of the femur. We'll move into the hamstrings now. We've got biceps femoris. The origin is the ischial tuberosity and the lateral lip of the linea aspera, and its insertion is the head of the fibula. Semimembranosus is just deep to semitendinosus, the other hamstring, and will originate at the ischial tuberosity and insert at the posterior aspect of the medial condyle of the tibia. Semitendinosus will also originate from the ischial tuberosity and will insert at the pezantherinus tendon near that proximal medial portion of the tibia. Turn back over, we've got rectus femoris. It will originate at the anterior inferior iliac spine and will insert at the tibial tuberosity via the patellar ligament. Vastus intermedius will originate from the anterior and lateral shaft of the femur and will also insert to the tibial tuberosity through the patellar ligament. Vastus lateralis will originate at the lateral lip of the linea aspera, the gluteal tuberosity and greater trochanter, and will insert at the tibial tuberosity via the patellar ligament. Vastus medialis will originate at the medial lip of the linea aspera and will also insert to the tibial tuberosity through the patellar ligament. The sartorius, also the longest muscle in the body, originates from the anterior superior iliac spine and will insert at the pes anserinus attachment site in the tibia. I chose to bundle these three together. They're commonly known as the ellipsoas. So we've got the iliacus, which originates at the iliac fossa and inserts at the lesser trochanter of the femur. We've got psoas major, which will originate the transverse process of the lumbar vertebrae. Some people say that includes the very bottom thoracic vertebrae. My resource shows lumbar vertebrae. It will insert at the lesser trochanter of the femur, also sharing a tendon with iliacus. And then we've got psoas minor, which will originate at the transverse process of the first lumbar and insert at the superior ramus of the pubis. Next is the tensor fasciae latae. It will originate at the iliac crest posterior to the anterior superior iliac spine and will insert into the tibial tubercle via the IT band. The IT band is shared, tensor fasciae latae, and with several of the glutes. Gluteus maximus will originate at the coccyx, the edge of the sacrum, the posterior iliac crest, the sacrotubercle ligaments, the sacroiliac ligaments, and will insert at the gluteal tuberosity on the femur and the tibial tuberosity through the IT band. Glute medius will originate at the gluteal surface of the ilium between posterior and anterior gluteal lines just inferior to the iliac crest and will insert at the lateral aspect of the greater trochanter. Glute minimus will originate at the gluteal surface of the ilium between the anterior and inferior gluteal line, just inferior to glute medius's origin. It will insert at the anterior aspect of the greater trochanter. Piriformis is one of the deep hip rotators, but I felt like it deserved its own place. It can cause a lot of pseudo-sciatic pain. Its origin is the anterior surface of the sacrum, and it will insert at the superior aspect of the greater trochanter. The sciatic nerve will run just deep to the piriformis, so if it's tight, it can cause a lot of problems for sciatic pain. I chose to lump together all of these other deep hip rotators: gemellus inferior, gemellus superior, obturator externus, obturator internus, and quadratus femoris. For the purposes of massage therapy, these can be a little tricky to palpate, but kind of back that posterior aspect of the femur and between the ischium, the sit bone, you can apply some pressure. And I like to engage some lateral and medial rotation here to just encourage those to relax. Thanks for watching. I hope you found this video helpful.